Good afternoon, and thank you all for joining us today for this webinar on charting a sustainable recovery, a virtual event series that UCLA is putting on. I'm J.R. DeShazo, Director of the Luskin Center for Innovation at UCLA, and I'd like to kick off the session by thanking all of our community partners who have helped us organize today's event. I'd like to recognize that as a land-grant institution, we at UCLA acknowledge and honor the sacrifice of the Gabrielino and Tongva peoples as they were the traditional land caretakers of Tongva, the land upon which our campus now stands. We have a really exciting conversation ahead, but first I want to give a big thank you to our panelists who you'll hear from shortly. Dr. Joaquin Arambola, California State Representative from the 31st Assembly District, Margarita Rocha, Centro La Familia, and Jose Marin and Luis Soto from Valley Clean Air Now. I'd like to pass it over to my colleague, Dr. Greg Pierce, who is Associate Director of the Luskin Center for Innovation. He leads our work on transportation equity, environmental justice, and water equity work. He's also an adjunct professor in the Department of Urban Planning, and a great colleague of mine. Dr. Pierce, take it away, please.
Thanks everyone for joining. I want to again make just some brief motivating remarks around why we're here, and what a little bit of a preview of what you'll be hearing from our other partners on this webinar. First, why we're here, several reasons, but particularly as the Luskin Center for Innovation, what you'll hear about today, what we'll talk about today really reflects one of our long-term or several of our long-term focus areas on supporting, providing research to support planning and policy for clean transportation, environmental equity, and other vital services across California. We've been working particularly with Valley Clean Air Now for some time on these efforts and with these other partners more recently. And secondly, another reason we're here is that this is the second in the series of webinars we've been hosting on charting a sustainable recovery to the COVID-19 pandemic. Our first webinar was focused sort of on statewide approaches and investments in charting a sustainable recovery through environmental incentives and looking at broader economic effects. But we're really excited about this webinar, taking a focus on practical solutions to providing clean transportation and that transportation providing access to essential services. And if there's two words I'd like you to remember from today, of course we'd like you to remember all the words, but the two words are adaptation and essential. And each of the organizations you'll be hearing from, Assemblymember Arambola's office, Centro La Familia, and Valley Clean Air Now have really, both together and in separate efforts, demonstrated sort of innovation in those spaces, adapting the efforts they were already undertaking to provide essential services to residents, particularly disadvantaged communities in the San Joaquin Valley, but adapting them to the COVID-19 pandemic, which we all know the challenges of, and doing that for services and needs that are really essential and have been exacerbated by the pandemic. Of course, we've all heard a lot of negative stories about government and non-governmental response to the pandemic, but what I think we can really offer here are both positive stories and practical solutions that can be scaled both within the Valley and beyond. And just as an example of that, again, we know this is reflected in all of our partners' work, but particularly we had a chance to partner with Valley Clean Air Now on a case study focused on their response. What's really impressive about what you'll hear from folks today is not only have these organizations sort of redoubled their efforts and changed their strategies overnight to meet essential needs for residents of the San Joaquin Valley, but they've actually in many ways expanded those efforts. For instance, Valley Clean Air Now's smog program is serving 3 to 4 times more people than it was before the pandemic. It's further sort of disseminated benefits of its program to disadvantaged communities above what it was doing before the pandemic, and also helps support, again, sort of broader economic recovery or sustainability efforts in the course of its work. But with that, I want to stop talking and turn it over to our other speakers and back to JR to introduce our next speaker.
Thank you so much, Dr. Pierce. Really appreciate those framing remarks. Next, it's my great honor to welcome to this webinar Assemblymember Dr. Joaquin Arambola. Dr. Arambola served for 10 years prior to becoming a policymaker as an emergency room doctor in Selma. In his capacity as an assembly member, he represents 41% of the city of Fresno, as well as many of the surrounding rural cities and communities in Fresno County. He's been a champion, as you might imagine, given his professional background of healthcare issues, including improving healthcare access for all Californians, addressing the critical shortage of doctors and other medical professionals in the Central Valley. He's also fought for water supplies in the Valley and authored legislation to improve health and mental health services, as well as trying to ensure transparency with regard to the management of those services and their cost that are borne by community members. Assembly member, thank you so much for joining us. I'll turn it over to you now.
Thanks so much for having me, and what an honor it is to be joining you here today. Earlier this week, I had the privilege of speaking with our speaker as he shared a piece of literature that I was quite interested in. Hemingway, who was around during the last pandemic a century ago, had a way in which he wrote about that pandemic that oftentimes I believe we are lacking in today's society, is an appreciation and understanding of what these pandemics can really do to our communities. Living here in the central San Joaquin Valley, we for a very long time have been figuring out how to adapt and to live with barely being able to hold on. When I was an emergency room doctor for a decade, one of the things I saw was when people couldn't live, when they couldn't afford the preventative services, they'd come into the emergency room seeking care. And it was there that oftentimes I would hear their stories of systems that were not working, systems that oftentimes led towards social determinants of health that exacerbated their underlying health problems. As we are looking at this pandemic and looking towards our systems, I am keenly aware of those disparities and attempting to make sure that our systems are working to make them better. And so I wanted to talk about some of the things that we're working on here in the Central Valley, and I'm pleased that you would have me join you here today. But we're organizers here in the Valley. We've been that way for a while. I was born in Delano in the middle of the farm workers movement, and I've known an organizer or two in my life. And I want to tell you about some of the organizing we've been doing around this pandemic. Our Central Valley Community Foundation has been organizing weekly calls with 200 to 300 CVOs, partners, participants, who get to talk about what our needs are in the moment, what issues we're having with being able to afford and make ends meet, what it's like for people who can't afford to put food on the table, who have recently lost a job, who are struggling to keep a roof over their heads. These types of conversations are not easy conversations and are difficult ones, and are only able to be productive if we're able to put all our heads together. These weekly conversations have been great opportunities for us to direct resources to those who need it the most. It is through these calls that we've heard of the need for immediate emergency food assistance, for improvements for our undocumented community to be able to apply for emergency aid. We heard about the struggles that many families were having, as we all know too well ourselves, with homeschooling and the economic distress that this pandemic has caused. And so I was pleased that our local community was working so hard collaboratively together to figure out how we could provide resources to those who need it the most. But when you're from a poor part of the state, as I am, we oftentimes don't have the resources to take care of the issues that occur in our communities for the people who live in this part. And I am a bit triggered, if I can say, as you talk about essential, because it is my community that is being deemed essential. It is my community that is out there working the field each and every day during this hot summer to continue to put fruits and vegetables on other people's tables. And I'm sensitive to the fact that oftentimes we don't meet my community's essential needs, and that while we are able to fill other people's tables, we can't take care of our own. And so it's with that thought that I serve as the chair of our Sub 1 committee at our state capitol, where I oversee our safety net, our health and human services programs. Every dollar that our state spends in that social safety net comes through my committee, and I have an opportunity to make improvements to them. And so I wanted to talk about some of the things that we most recently did in our state budget this past week that I believe will help us in this pandemic today. First, I want to talk about CalWorks. And those of you who don't know, this is a government program that predominantly women and women of color who go on to government assistance for the first time require. And unfairly and unjustly during the last recession, we had changed that system to make it more burdensome and make it so that it didn't work for our communities. We were able to rectify that in this budget by removing some of those barriers and allowing us to go back to a 60-month time clock, which will allow the program to go to its desired effect, which is to help women of color get back to work, and believe that by improving this system, we can fundamentally help us to improve our economy and recover from this recession. And it is with that mindset that I was trying to improve the social safety net, knowing that those investments will simultaneously help us in our economic recovery as it helps those who have the greatest needs. But I wanted to talk as well, if I could, about CalFresh and the streamlining that we've been doing within the program. The emergency aid that we gave towards our food banks that was within this budget, the funding, that stabilizations that we did within our IHSS, as well as our developmentally disabled communities, will help us to maintain and secure that safety net. I also want to speak, if I can, about how for too long we just have not been our undocumented community. And I think that's the part I want to end with here, is that as we're looking at the disparities within the systems, the Federal CARES Act explicitly and deliberately and unjustly excluded our undocumented community who was deemed essential and necessary for our country's livelihood, but were not included in many of the emergency assistance. I'm very proud that here in the state of California, we have been leading on this issue and helping to provide resources for all of our communities so that all of our communities can thrive, so that we can have a California for all that includes all parts of our states, the Central Valley included. So I will as well stop and listen to the rest of the presenters who are on here. As Centro La Familia, I am a big fan, and Margarita has been a longtime advocate in the Valley, and know that she's doing quite a bit of good work, as well as Valley Cam. I just wanted to come and add my voice and share that in the Central Valley, we are trying to figure out how to rise out of this. And I think we have to look towards strengthening our social safety net and making it work better for our communities. Thanks for having me on right now.
Thank you so much for those remarks and insights, Assemblymember. We're very grateful to have you with us today. I'd like to turn now to Margarita Rocha, Executive Director of Centro La Familia Advocacy Services. Margarita serves as Executive Director and has held this role for more than 25 years. Through her leadership, she's transformed it from a small grassroots organization into a resource provider for the Hispanic Latino community, growing a staff of 5 to over 65 staff members. Margarita, thank you so much for taking the time to speak with us today.
And I thank you all for this invitation. We are also very honored to be part of this conversation. And we'll want to share with you some of the work that we've had to redesign, we had to adapt to. And as you mentioned, Centro has been in the community for a long, long time, and we work to stay here for a longer time, responding to some of the needs of our community. Our mission is providing services that empower and support families and individuals in our culturally diverse community. Therefore, that mission is what drives us to continue to provide services as an essential provider. On the screen, you will see some of the types of services that we provide at Centro La Familia. And therefore, that is why we are important to remain open, because these services continue, but they continue in us having to find a new way of serving the families that we serve under these different types of services. We're an essential provider because we also do a lot of work with CalWORKs and child abuse prevention programs, which are state programs. But I can tell you that since the shelter in place was announced, between March and May, we have responded to over 6,000 calls in a 2-month period. We have served over 2,600 walk-in clients with different emergency needs. This work is added on to what you just saw as the type of services that we provide, because a lot of this was a questions of response to the fear of not knowing what COVID-19 really meant. And I got to tell you that internally with my staff as well, there is fear. I mean, we're all worried, we're all concerned. I don't think that any of us feel that we're immune to it, but yet we keep doing our work because our work is to serve. But how we've had to modify, obviously the very first one is in place with the state requirements of face mask, glove requirements, screening tools for staff and clients as they come in. My staff goes through a screening every morning to assure that they're well to work, and if not, they need to go home. Our clients, if they're not well, we have to reschedule appointments for them to come in. We practice the social distancing and all of the other things that we're required to do. It has been a challenge because clients also have to adapt, and sometimes this is not easy for them. But part of it, the other is that, well, we used to have group people come in for appointments. We now highly encourage that who has an appointment, that's the person that comes in. The virtual visits that we have to do because we case manage clients and we must be in touch with our clients are turned over to virtual phone visits that can be from an hour to 2 hours because we're still counseling. We've had to increase our food distribution. We've created family care packages, which with the family care packages means that if we have families we're case managing, we actually are delivering food directly to their doorstep. And that is different from the large food distributions that we're doing. We have also been able to establish an assistance with emergency funds. And also because outreach and education is a big portion of our work, we have had to find different ways of how to do that. Part of the way that we've done that is to take advantage of Facebook Live sessions and different forms of getting the message out to our clients. We have garnered more than 10,000 views. We went back and checked the numbers. Over 10,000 people have hit that view button to see the information that we're taking out to the community. So we're adapting to the new normal so that we don't have to interrupt the services. And even though the shelter in place has been lifted, the safety of staff and clients continue at the forefront of everything that we do. So you'll see there that the family care packets, as I said, we have served over 1,200 families through this venue. They contain the food that we try to be culturally sensitive to. This is a way that we also use to take out our outreach and information. Specifically, very important also at this time is the census. So this is another measure of how we get our census education out to the families. And we do let them know that that information is coming in their packet as well as any other, and that we'd like for them to call us if they have any questions. That is something that we've had to be really thoughtful about, is how do we still do this work and get the information out that we need. Another great thing that we're really happy is the direct assistance with rent and utilities and other urgent needs. We have been able to, we first started with what little funds we had in-house. And then of course we were able to have folks step forward and provide grants to us for this. So with over $100,000, we've actually served over 80 clients with rent, utilities, and other household items to keep them sheltered in their own homes. We've done the huge food deliveries, partnering with Valley Can, the Consulate of Mexico, Power of One, the office of Dr. Joaquin Arambola and his staff, because actually Dr. Joaquin Arambola was the first one to provide a donation to us, which helped grow the fund to the $100,000. And we are working with other potential folks who will be donating additional money, because obviously $100,000 is almost gone. Some of the rural communities that we have distributed food in have been in Huron and Mendota, and those reached and served over 2,400 families. And this work cannot be done with all the different people who stepped in to help us, different organizations and volunteers and young folks. And we do have some photos on Facebook that tell you, that show you how energetic we are. And I mean, we may be the coordinator of many of these things, but none of this work can get done without all of the help that we get from all the community. And some of the folks that are on the panel today have been real instrumental as well to reach the families that we know are so underserved. You will then see also that we are in 3 different locations. Fresno Street, our main office is on Fresno. Then we have one in Kerman, and we have one in Highway City. And so we remain available to anyone who has further information or has clients that need services. Please let us know. We'll be so happy to work through them. I really appreciate this opportunity to give you some updated information. Thank you.
Thank you so much, Margarita Rocha. We really appreciate you sharing that information and update with us. Next, it's my pleasure to introduce Valley Can, and with whom we have worked, with whom UCLA has worked for many years, supporting their efforts, and with Tom Knox and other members. We have 2 speakers today. We're very fortunate. We have Luis Soto and Jose Marin, both of whom support either the Tune In, Tune Up program, which is a smog reduction program, or the Clean Cars for All program, both of which have been very innovative pilots and community outreach-based programs in the Central Valley. I have to say, when I was preparing today and I saw that Jose Marin was the youngest of 8 siblings, it caught my eye because I'm the oldest of 7. I can't imagine what it's like at the other end of the distribution there in a family as large as that. And so I want to welcome both of them and thank you all for being with us today and sharing Valley Can's perspective on these issues. I'll turn it over to both you gentlemen. Thank you.
Thank you, Dr. JR. What an honor to be here. And yeah, you know, being the youngest of 8, opportunities that the others didn't. And, along those lines, growing up here in the San Joaquin Valley, witnessed firsthand, the necessities that exist throughout. And that's really what brings the passion into my longstanding career serving the community, precisely in the San Joaquin County area, with, over a decade with Valley Can throughout the 8 counties of the Valley. So, the work that we do with Valley Can, it's day to day serving the community with various challenges, because while, yes, our programs serve to repair vehicles, to help folks with retiring vehicle, but it goes beyond that. Valley Can's outreach and empowerment I've been doing it for a little over a decade. Prior to joining Valley Can, I learned to enjoy working in the community, ever since I could remember. Community engagement, outreach, empowerment, just bridging that access between resources and actual individuals who I relate to very closely has always been very passionate. I currently work with hundreds of community groups, churches, local leaders, elected officials, government agencies, non-government agencies, some organizing groups that are not even registered, those who wish to have the minimum interaction with government, all of whom who have helped to build the very dependable network that helps us turn out over 10 to 12,000 customers each year to our various programs. All this thanks to the partnership and support of our friends at the San Joaquin Valley Air Pollution Control District. So, speaking about the subject of today, what about COVID-19? What did Valley Can do when COVID-19 hit? Our program was based on in-person events. We planned to expand it 32 tune-in, tune-up smog repair events and 120, that's 120 clean car community clinics in 2020. Valley Can focuses on vehicle emissions reductions, but what we're really doing is solving problems that prevent low-income residents from being able to move around safely and affordably. If you can't afford smog repairs, your vehicle registration expires and you're then in constant fear of being pulled over by the police, which can escalate into bigger problems that none of us wish to have. If all of you can afford is a 25-year-old car, you're going to be paying a lot of weekly paycheck for gas and maintenance. Helping our customers solve their mobility problems means they're freed up to focus on their family's needs, their family's futures. The key element to our successful outreach has been building trust through years of events, through years of establishing this wonderful network with organizations such as Centro, La Familia, such as Comerciantes Unidos, such as the UFW, such as other organizations, Las Promotoras of Kern County, just various organizations that have opened their doors to us 10 years ago and said, you know what, you guys are on to something, and we want to be part of that. And their clients, their participants, really believe in these leaders. They don't believe in us back then. Now, because the message has been reinforced through somebody they trust, now they trust Valley Can, and that attributes to the successes of Valley Can. Our customers have vehicle problems, and they hear about our events through someone they trust. They have enough faith that they'll drive their car with expired tags to the event. They then share their information and trust that it won't be shared with any other government agencies. That trust is repaid once they get their smog repairs completed or their car replaced with an affordable use plug-in hybrid vehicle. They then pay the trust forward by telling their friends, their relatives, and the network that keeps expanding how well they were treated when they came to our event, when we had in-person event. Now that we made the switch to doing phone banking and assisting people virtually, that network continues to expand. Our local leaders continue to say, hey, Valley Can did not shut down. Valley Can continues to go. Our message is, throughout all of the social media platforms from our partners, our media partners as well, that have made, their avails available to us so that we could deliver that message of these emissions reduction incentives available to the participants. The statewide shutdown forced us to adapt, but thanks to our longstanding network of trust, we were able to adapt in a matter of a couple of weeks with a new model based on radio and online. While we, the advertising designed to generate phone calls to our bilingual event team, while we're using paid advertising, our media budget is relatively small and still depends on a big boost from community partners throughout the Valley who amplify our message. And most importantly, encourage their constituents, their participants, their clients, their family, their friends, their neighbors to take the risk in reaching out to us with the message that, all you have to lose is at the bare minimum, you're going to get a free small check. Networking and community partnerships are still the most important part of our program. I want to thank big thanks to the UCLA Luskin Center for Innovation team for publishing the case study on Valley Can. For those of you in attendance, please feel free to download the report at their website. While we lowered our barrier to entry and had many more people coming to the program, our average Callan virus screen has increased, showing that we are serving a more disadvantaged audience in general. We rotate these virtual events throughout the Valley so that we can penetrate deep into these communities for a week or two, and then we move on to the next region. We have seen that it takes several days for phone calls to really take off, and there is a lot of evidence we've seen that our network of regional partnerships is helping to drive these numbers. We have right now, as we speak, a campaign going in the local community of Delhi, California, which is, a very small community that, of course, we are not being exclusive. To the contrary of that, we are trying to be as inclusive as we possibly can. We have identified there's one zip code in the city of Delhi, so we extended our outreach to all of our partners throughout those communities. This is in Merced County. It's going extremely well. We wanted to go into this suburban communities and be able to offer these incentives firsthand so that people in these communities relate to the message and react to the message and make it accessible so that they could help us lower vehicle emissions. And for more information on how we're executing the virtual events, both on the Clean Cars for All program and the Tune In, Tune Up Free Smog Repairs program, I'm going to go ahead and turn it over to my colleague, good friend, and someone who I really, within our work ethic, look up to greatly. He's an auto mechanic graduate of Merced College, and we brought him on board back in 2013 as a young student of Merced College. But man, he had the knowledge that Valley Can really needed. And I'm proud to hand it over to Luis, who will amplify on how the COVID-19 pandemic took Valley Can in a different direction to deliver the same, if not better results within the last 4 months of delivering the vehicle repair vouchers. Luis, and thanks again, UCLA Luskin Center for Innovation, and Dr. JR.
Thank you, Jose. Jose is right. I've been with Valley Can since 2012, and originally was brought in as a volunteer, for the Merced College. They used to have colleges bring students to the events and help them do car diagnostics, so certain things. And like I said, I've been with Valley Can since 2012, and I work in a variety of roles there in Tune In, Tune Up, and as well as I help develop our Clean Cars for All customer qualification process. As Jose explained, we have to replicate our in-person event process with advertising in social media that encourages customers to call a phone bank, which I happen to manage. And that phone bank is open 16 hours a day, 7 days a week. We we talked about the importance of adapting our program to continue to help the people in need. Sometimes there's things you just have to do. You can't just let people on their own, especially with the situations that are going on. Luckily, now there's very affordable technology available that we could use to connect people in a simple but efficient way. I strongly believe that throughout the years that I've been with ValleyCan stands for being able to do things efficiently, simply, but efficiently. It took a couple of days to work out the details, a couple of days, a week or two. But one of the key lessons that we have to offer here is that if management comes together, nonprofits can adopt powerful tools to work around their COVID-19 challenges. Like Jose mentioned, we had a plan to increase our volume of events, and then COVID-19 hits, and we just said, hey, we have to do this. We have to do something. So I reached out to our long-lasting staff, who we believe have a positive attitude and a level of customer service needed to perform this task. After the first 2 weeks of running a virtual event, we received several calls, which personally, some of them impact me, not all of them, impacted my life in a personal way. Customers that heard of the events that had to be canceled in Bakersfield, they called constantly and said, hey, I don't know what I'm going to do. And we were able to place them on a hold before we were actually able to launch our virtual event. And as soon as we did on April 17, we had the staff calling back and said, hey, we never shut down. We took, a small pause to regroup, to rethink, and to be able to relaunch our events in a different way. So those stories are, those are the things that move me, like I mentioned, in a personal way. There's people that call and their biggest concern was of having vehicle to continue to get to work safely. And like many of us have mentioned, and this is what we're hearing from 80% of the people that call our phone bank. They're very worried about being able to drive safely and legally to work. But they don't have the money to fix their vehicles. And if they don't have the money to fix their vehicles, then they're not able to re-register their vehicle again. So this creates a lot of stress that it's already coming from the fear of getting sick and not being able to provide to their families. And now they have another thing to worry about, and they have to spend money out of their pockets to fix their vehicle, because there is no other way around of getting to work but having their vehicle. So by having our phone bank open from 6 a.m. to 10 p.m. at night, 7 days a week, we make it easy for people to call anytime. We, especially with the diversity of jobs these people perform, they call at any time during the day when they're available. Once they call and share some of their information, very little, we're able to text them a small repair voucher, and we do a three-way with participate in a small shop around their area. And, we help them set up an appointment right on the spot. We're getting around 250 calls per day, but many of these calls are for information and aren't ready to provide their info. So they call back at a different time or a different day. Around 90 calls per day last more than 2 minutes, and almost all of these customers receive a voucher. We also receive approximately 40 online forms on a daily basis, and we're able to connect with around 10 of them by phone, and we give them a voucher. And like I said, we connect them with the shop. And the bottom line is that, give me a second, my mouse. I have a slide here. Bottom line is that we're now granting approximately 2,200 vouchers per month. And it appears that 90% of these customers are showing up to their small repair appointments. And at this rate, it will give us many small repair vouchers in 3 months during a pandemic that we would normally deal with 1 year of events. This has been overly exciting a couple of months as I have learned new skills and I developed a new business process. People are grateful. I I always like to share one in particular participant that call with such gratitude, that he had. He called me and he said, I quote, this is what he said exactly. He said, "I don't have a way to repay you, but I can give you some cherries, so that you can share with your family." This is immigrant families that work. I happen to also be, a son of an immigrant family. I know the struggles that they, go on a daily basis, and I know how hard it is to not have the means to get to work, and your job is basically what is supporting your entire family. There is not much help sometimes available for those people, especially on some of these communities, these advantaged communities that we have. So, when he called me and when I hear all of these testimonials, it just makes me, want to continue to do this. Our efforts and all of our hard work it's worthwhile doing it. The outcome of all of these vouchers is that we're going to be able to reduce significant emissions. And I'll go ahead and select another slide for that, but we're going to be able to reduce significant emissions, where they are needed the most. The link between respiratory health and COVID-19 is clear. So we're happy that our work can play a part in making communities a little bit less substile to catching the virus. We have the slide here and the emission reduction results from the first 60 days of operations. We are projecting emissions reductions of more than 500 tons of harmful HC, CO, and NOx every month. This is relevant to COVID in two ways. The older the cars are driven in San Joaquin Valley, these managed communities are collectively one of the largest unregulated sources of criteria of pollutants emissions in California. Post-COVID, there is a better understanding of the link between air quality and public health. Reducing these emissions from the dirtiest cars on the road has a direct air quality benefit in these managed communities, which should help improve health against future COVID infections. Overall, I would like to say that Valley Can is here to help. Both of our programs, Tune In, Tune Up, as Clean Cars for All, which our model for the phone bank is the same on Tune In, Tune Up. We have a 1-800 number for the virtual Tune In, Tune Up, and we have different phone numbers with different area codes on the radio advertising for the vehicle replacement program. We never shut down. We regroup. We want to help people retire their cars, fix their cars, allow people to go to work, allow people to support their families, and help them. There is help available, and not only for their transportation issues, but even in other areas. There is food being distributed now, and we've been we're very grateful to be able to be part of that as well with Centro, La Familia, Dr. Joaquin Arambola, and many other organizations that are helping. And at the end of the day, Valley Can wants to help. I want to help personally, and this is what makes my job and many of the people that are in here meaningful. That we're able to impact someone's life, some child that it's in there, and we just want to help. So thank you, Jose. Thank you, JR. Thank you, everybody that is here, and we appreciate the opportunity of being here.
Thank you so much, Luis and Jose, for that presentation. So now we will open it up to Q&A from our web audience. Feel free to type your questions into the chat box, and we will sort through those and present them to our esteemed panelists. I'd like to start off by asking, a broad question about what are the most important unmet needs within the San Joaquin Valley associated with COVID, if we anticipate this challenge continuing for another 6 to 12 months. What are the things that you feel like should be the top policy priorities? And I'd like to turn first to Assemblymember Arambola to address that question if he'd so like to do.
Thank you for the question. As we're in the midst or early parts of this recession, I think we need to be focusing on recovery. As we're looking at 20+% unemployment, I think we have a responsibility to make sure we have an eye towards working on recovery. And that means working with communities like mine that historically have lacked opportunity to figure out how we rise out of this pandemic stronger than we went into it. 80+% of the district that I serve does not have a college degree. How do we make sure they still have the resources to put a roof over their head, even with the economic headwinds that we're facing? So I think I would just say that we need to make sure that the economy that is going to come out of this pandemic 6 to 12 months from now, that it works for communities like mine, that it works for disadvantaged communities, to make sure that we have enough to put on our kitchen tables as well.
Thank you so much, Assemblymember. Let me turn to Margarita Rocha and ask you the same question. Are there specific issues that you see coming out of COVID that you'd like to elevate?
Yes, and I have to agree with Assemblymember Arambola that one of the things that happens in our communities, low-income communities, when we have such issues as COVID, these are the highest impact communities and the ones that take the longer to recover, because sometimes the economic status is already at what it could barely survive on. And I say that concerned that survival is even a word right now. So I agree with that. But one of the things I want to make sure that we, in the development of these policies, and that they're broad in an umbrella style, but as you drill down, one of the things that I'm seeing right now today that is not going to help us move forward if it's not addressed, and that is still the lack of education into rural communities and farm working communities and people who work in labor. Because firsthand information that I've received recently, observed by farm workers, are that COVID-19 farm workers are still not getting the supplies and equipments that they need that would help reduce the COVID-19 epidemic. That sometimes the messages received by the workers from the actual supervisors is that COVID-19 is not real, or that the workers are so fearful of not having a job, they continue to work even if they have some of those symptoms or are not getting tested. So the big issue right now is, how do you get testing out to those communities? How do we better educate in such a manner that it's not punitive to the ag industry, but also not punitive to the worker, that they may have said something for their own health. And these workers have to go home, and they have families. And therefore, right now, we're not even moving out of that particular window. And I really believe that the folks that shared this with me are very serious, because they are workers themselves, and this is what they're seeing firsthand. Transportation, and how do they get to work? They travel, in groups, and that is the only way they can get to work. So how do we establish some safety net for these workers in the ag industry that needs to have the workers, but you need to have a healthy worker? So, I mean, these are some of the things that have shared with me recently, and I wanted to share them here today.
Thank you so much for doing so. We're very grateful for that. Yes, please, go ahead.
No, I just was hoping to be a little iterative, if I could, and discuss. And, Margarita touched on something I think is quite important. We've had an educational divide, a digital divide in the Valley for a while. I think this only gets exacerbated with this pandemic, and do think that's a structural issue, that if we don't make sure we're being cognizant of will be very troubling for our communities. But she touched on something that I really don't want to be lost here. People are barely recovering from the last recession we had. People are barely able to put food on their table in normal years. And when you add on things like a pandemic, it only makes survival that much more tenuous. And really do want to speak to what is occurring in our communities so we can have an honest conversation. Because if we're not speaking that truth about how people are going hungry in the breadbasket of the world, I don't think we're being realistic of the magnitude of the problems we're facing in this pandemic.
Thank you, Assembly Member. Really appreciate that. So I want to pivot a little bit to a specific question we got from the Coalition for Clean Air, a member online. They wanted to know for ValleyCan, how have you overcome or worked around the digital divide as you try and serve low-income and communities of color?
Thanks, Dr. JR. And, you know, we have always considered the different barriers and accessibility options that exist throughout our communities, you know, within the San Joaquin Valley. That was one of our things that we discussed. How are we going to make deliverables to these communities? And certainly, you know, we've kept the message fresh within our various partners throughout the San Joaquin Valley, whether it's people that have attended to pick up a food basket, as Margarita was stating earlier, or any of the other essential services. You know, our network partners have maintained the accessibility and fresh message there, alongside with making it available via telephone. And that's one of the things that Luis was speaking about. You know, our message has been available. And one of the things we learned is that because of the shelter-in-place order in the early months of the pandemic, we had we learned that, you know, people kept on our social media platforms much more time than they did back at the beginning of March and previous months. So we stretched the message to go deeper, more explicit, and encouraged everyone that had access to a telephone to please give us a call, and we would make all of our best effort to furnish the incentives via the telephone, via text message, via social media, via the web, but most importantly, continuing the message fresh in whatever medium source that these people had access to.
Thank you so much. So I think this may be my last question, given the time. I'd like to ask, are there other models of adaptation or other organizations adapting to the pandemic in the Central Valley that you all want to call out as potential examples that we might want to learn from? In areas, yeah, let me just stop with that. I think that would be a nice focused question. And feel free to just jump in at this point.
Maybe I'll start then if I can. I alluded to it in my opening comments, but the collaboration we did with the Central Valley Community Foundations, the organization of those meetings, is something that I don't believe is being replicated at scale across our state, and is a model that should be. It was incredibly important for our community to have those opportunities on a weekly time frame to be able to hear about how our needs were changing. Things were evolving during this pandemic, and we needed those opportunities amongst multiple different types of community benefit organizations to share information, to share how we were adapting to the pandemic, and just believe that umbrella, that architecture is something that should be looked at as it was incredibly helpful and important for our community, and hopefully can be replicated and scaled throughout the state.
So to add to Assemblymember Arambola, those calls of which I participate on in weekly, if that's what you're referencing, Assemblymember, includes our local government and our CBOs and government agencies. It's across the board. This is one of the few collaboratives where I have seen that number of different organizations. We all don't have the same model. We don't all serve the same community. We come from different specters. And it is very engaging. In the beginning, I was kind of like, okay, is this something like we do? And then there's not much out of it. But I can tell you personally that I have gleaned a lot of good information up and an opportunity to share any concern and to add questions that you may have from your own perspective. So I do agree that this is one of the best that I have seen.
If I may add as well, Dr. JR, one of the individual organizations or government agencies that really came to mind when you asked the question, is the various consulates. They're an entity that people relate to, that people trust, and the job that they have been doing in creating awareness, in establishing safety, and just the educational element, not to mention the community involvement that we've seen within the last 2 months from the Mexican consulate in this instance, has been remarkable. Along those lines, the various foundations for farm workers, Líderes Campesinas, who is, a longstanding friend of ours, La Fundación de Unión de Campesinos, Las Promotoras, all the safety measures they have made the people they serve, and all the awareness they've created is remarkable.
Thank you, Jose. Please, Luis, go ahead.
Yeah, I think I just want to add on the other side of communities, organizations, I think it's also the community. I think people see the need of other people's because there was an event, it was in Mendota. I noticed that there was people just showing up and said, hey, I heard of this event. I'm okay with food, but I want to help distribute this food. So I think that what all of these organizations are doing, it's also making other people jump on board because they see the positive attitude that it's creating. And when you see positive and you're seeing that you're able to help somebody or someone's life, impact their life in any way possible, it's something that we all want to be part of. At least on my end, but I am sure all of you guys share that same thought. And I think it's also people are coming together. And yes, the pandemic it's a big problem, but it's also unifying a lot of people that were divided in at a different time. So that's just my opinion on that.
All right, thank you, Luis. So we're at the top of the hour, and now is the time for me to thank each of you, to each of our panelists for sharing your experiences and perspectives on how we can chart a sustainable recovery, and in particular representing the experience of the San Joaquin Valley communities. We're very grateful that you've taken the time. And to our audience, thank you for tuning in. We'd love your feedback. You will receive a short questionnaire. We'd love to know what you thought, ways we can improve. UCLA is a public research university, and our job is to serve our community. And we do that by partnering with civic leaders and civic policymakers to try and help provide research and ideas and support for innovative programs that can be scaled across the state. So we appreciate any feedback you'd like to offer us. And with that, I will close. I hope to see you again at a future UCLA Luskin Center event. Thank you all and have a great afternoon.